Hi, I'm Dr. Mark Anderson. I'm one of the partners here at Healthcare Associates of Texas, and I've been asked to talk to you about virtual colonography versus optical colonoscopy as a screening tool for screening for colon cancer. Virtual colonography was probably brought to light about the year 2000. We started doing virtual colonographies here in the office at about 2001. But we've been doing these studies now for almost 20 years. We've done thousands of these studies, and it's only been recently now that these studies are included under insurance programs, oftentimes as a substitute or an alternative to doing an optical colonoscopy. So most people are familiar with the optical colonoscopy, and in general that's where patients are prepped, and the gastroenterologist will insert a fiber optic scope and explore the colon, looking at the lumen or the inside of the colon, and hopefully you get the good news that says no polyps or any other abnormalities were found. A virtual colonography requires the same type preparation, but instead of going to a facility where they do sedation, we usually do it under the CT scan, which you see here behind me. The CAT scanner then does a CAT scan of both your abdomen and your pelvis, and we compare those views to each other. If we find a polyp with a virtual colonography, we'll then refer patients on for a diagnostic test and have that polyp removed and sent to the lab for pathology. So some of the benefits of doing a virtual colonography over the traditional optical colonoscopy is it's generally a less expensive procedure. It's done in the imaging center and doesn't require any sedation, therefore it doesn't require you to have a driver. As far as the images that are obtained when we do the CAT scan, we're able to visualize internal organs, and oftentimes we can find other abnormalities that wouldn't have been identified had you just been doing the optical colonoscopy. So quicker, less expensive, and more information usually provides for a better outcome. The advantage of doing the traditional, more optical colonoscopy is that if a polyp were found, it could be removed at the time, whereas when we're doing the virtual colonography, should we find a polyp, we're going to have to refer you out to have it removed. So the virtual colonography requires just a short tube in the rectum, as you'll see on some of our other videos describing the procedure, versus an optical colonoscopy usually has a long fiber optic tube that's inserted throughout the colon, and it increases your risk of having a perforation, albeit very slight. Optical colonoscopy can visualize the lining of the colon, and so other diseases like Crohn's disease, ulcerative colitis would be picked up on it that would not be seen on the virtual, and therefore the virtual is not meant to be a diagnostic but purely a screening type examination. So the accuracy of doing a virtual colonography versus an optical colonography are virtually the same. So another advantage of doing the virtual colonography is that we generally get to visualize the complete colon. And so when we're doing the procedure, we actually go up into the colon in one direction. When we reach the end of the colon, we turn around and come back the other way. And so we get to look on the back side of these folds in the colon that oftentimes aren't visually seen on a routine optical colonoscopy. It's much more likely that you'll get a complete examination with a virtual colonography than you will with an optical colonoscopy. So thank you for watching this video. If you're interested in some more information about virtual colonography, we have another video where Dr. Gammon and I will be reviewing some of the images as obtained on a virtual colonography and showing just what those findings can look like. So if you're of the age 50 or over, or have a family history of colon disease, and you're in need of a screening test and virtual colonography sounds like an appealing option to you, you can contact us here at HCAT and schedule a visit to discuss what your screening options are and if virtual colonography would be the best option for you. You can visit us at healthcareassociates.com. We'll have more information on there, and there's contact information for scheduling an appointment. Thank you for watching Healthcare Associates of Texas. So do you drink much alcohol? What about a smoking history? Have you smoked often? Any family history of any diseases? Heart disease? Colon disease?